Okay, so now we're moving on to part 3. We're going to get into knee pain. So some basic fundamental stuff for knee pain. Nothing, again, too in-depth. And then we're going to kind of wrap things up around the Williamson books with all these different solutions, all these different tools in your toolbox that you now will have to addressing different pain scenarios when you see it. And you're going to see a lot of those on the midterm. So you're going to need to be ready to kind of figure out what it is and how to address it. Okay, so pain, as far as we're going to be concerned, it's going to have 4 different causes that we can do something about, or 3 different things that we could do something about. The first is that knee hyperextension. Some of you are doing that in the lab, where you're putting all your weight on the backs of your knees, and you're kind of hyperextending. So if you're standing for long periods doing this, you're going to get a lot of pain in the back side of your knees. It could go up into your quads, knee pain. And usually this is caused by excessive anterior tilt. And we know how to address that. We just talked about it earlier. How do we address excessive anterior tilt? Think about those book 2 exercises. And what are they doing? You need to know what they're doing, not just memorize the number. They're engaging the rectus abs to kind of bring us back into neutral. So we're not having so much weight locking our knees in the back of our knees. That's a common problem with knee pain with people that are standing all day. You can go after pretty easily, as an OT in the clinic. And then hip rotation while walking. I'm going to talk about this in the lab more in depth, break it down. The lack of rotation. The hip rotation seems to ease the strain and stress on your knees and your quads. Without it, can lead to some quad pain. And then if people are getting general knee pain, especially if it's more anterior, you can do an inferior knee mobilization technique. It's a very, very simple McKenzie knee extension that a lot of patients like. You can learn how to do it. It's easy to do it. Just make sure you're doing it in the right circumstance. If they have this knee and pain in the back of their knee from locking their knees, hyperextending their knees, don't want to do the McKenzie because it'll just make things worse. Very, very important thing. Lose big points on the exam if you put a McKenzie for somebody that has locked knees or hyperextension of the knees. And then definitely think of your PT friends around the knees. They are the experts on the knees, well, without a doubt. Okay, so this is the McKenzie. We'll do this in the lab. Again, if they're locking their knees into extension with a lot of tilt, don't want to be doing this. It's going to cause more pain. This should stop the pain. It should not increase the pain. And basically you're doing, if you look at the video, you're just pushing down, getting an inferior glide down this way, and it relieves stress in the knees. Simple thing can be very effective. Okay, so now we're kind of putting everything together around issues around sitting, standing, and walking. Kind of seeing where all this madness is leading. So you need to pull this Williamson Solutions up. It's in your Canvas under week 3, I believe. So these are pain solutions for all kinds of different problems you're going to see. They come into the clinic, they complain of this, you're seeing that. This is how you would treat it. Kind of like a cookbook kind of thing, problem solution. I sit all day and my neck hurts. So you're looking for that forward head. It's very typical of people who are working with a laptop, cell phone a lot. Which ones are you going to do? That number 5 is a good one. Those explorations 1 through 4 get more of that nice tilt in there. Spider-Man's a good one to get more extension of the trunk. I sit all day, my upper back hurts. Rounded shoulders might be the problem there. Bringing those traps back. 1 through 4, Spider-Man could be good for that one as well. Sit all day, my low back hurts. If they have a flat back, a lot of times people have a flat back. 1 through 4 again, those first ones you did, can bring it forward. If they have excessive engagement of the abs, you go in the other way. Doing exercises 1 through 4. That is in book 2. Full engagement of abs. Alright, staying all day and my feet hurt. We talked about that with the ball stuff. And those exercises around the foot, the grasping of the arch. And then with the pencil thing, weight bearing through the ankle bones. Low back, standing low back. Again, it adjusts the tilt, depending which way it's going. Go the other way, basically. Bending more at the hips. People have a hard time doing it. They don't want to use their hips. They want to use their whole back and kind of all together. These explorations that you'll do or have already done will help with that. And then the knees. We just talked about the knees, what you can do about the knees. It's kind of broken down here. It's all organized together. We're going to start studying for the midterm. Know this chart. Know it really well. And again, don't just list the numbers. Tell me why you want to do what you're doing. I got to see the rationale behind that. And this will be your lifeline for the case. I'll get into the case in a little bit. How to break down the case and use this Williamson stuff in an organized fashion. Doing the homework, really prepping. It's kind of a simulation almost of what you're going to have to do for the exam. Okay, so that is that.